Hey guys, welcome back to Scanning the Mind. For those who don't know us yet, I'm Varun, I'm a trainee radiologist in the UK.
And my name's Sanchit and I'm a psychiatry trainee in the UK.
What we thought we'd do today is specialties we hate. The worst specialties, at least in our humble opinion.
The things we cut straight away. Immediately, they were just gone. One of the earliest specialties I cut from one of my potential future careers was any form of surgery. Throughout medical school, I never enjoyed anatomy. Then all the surgical placements, I just hate being in theatre. Because a lot of it was just like standing around, watching people work on very small areas of the body. You can't really see what's going on. You're either just holding something and not really doing much. I never really enjoyed the actual practical aspects of it because I didn't really get that much involvement in it. But I also never enjoyed the theoretical like anatomy and stuff.
Oh, okay.
So for me, it was just a massive no-no. And then on top of that, surgery is known for being super intense. Like the work-life balance isn't great compared to other specialties.
There was literally no reason for you to do surgery then.
Yeah. There's literally none.
Did you ever consider it before you, let's say, started med school?
I think before starting med school, everyone has a bit more of a fantasy view of surgery because of how you see it on TV.
Yeah.
So you watch like Scrubs or House or whatever, and they portray surgery in a way which is very appealing. But once you actually go into medicine, you start learning about stuff and you learn how surgery actually works in hospitals here. And how the training program is and stuff. It's very different.
Yeah, it's not like TV.
Yeah, there's no glitz and glamour.
You might be surprised. If you had to do this type of surgery, like gun to your head, like you have to be a surgeon.
Yeah.
What are you doing?
ENT.
Oh yeah, okay.
Had to be ENT.
Yeah.
How about you then, Varun?
So Sanchit, I think you might have guessed this. And I think people who know me might have guessed this. Psychiatry.
Fair.
My personality is not set up for psychiatry. I think on paper psych is a very good job. Like, you know, the work-life balance is pretty good. The training program seems pretty good because the trainees I've spoken to are pretty happy. The consultants I've met are pretty chilled out. There's quite a lot of private work. I get the impression if you want to do that, or if you want to work in the NHS, there's plenty of work to go around.
Yeah.
But I'm not a very patient person.
Fair enough. I think that's the one thing you need is patience.
I don't like talking to patients for too long. You might have guessed, seeing as I'm a radiologist. I do like talking to them, but just not for
the hour-long.
Yeah, I'm not about the hour-long consultations. When I was clinical on the wards, I quite like talking to patients for 5-10 minutes, maybe 20 minutes if I'm having a conversation about something complex, like management-wise. But that was the limit of it. And psychiatry, man, how long do you have for each consultation?
A new patient, you get an hour. A follow-up would be half an hour.
Yeah. Another thing is, if you haven't seen Sanchez's video about misconceptions about psychiatry, check it out.
I'll link it up here.
Yeah, one of the things he says on there is people have this misconception that patients don't get better. It's not true, patients do get better, but it just takes them a long time to get better. That's why they're inpatients for months and months. And again, that's something I don't like. I want something immediate, so I do something and the patient gets better, or you report a study or whatever it is. I don't want to be dragging on forever. Other thing about psychiatry, which isn't exclusive to psychiatry, but there's not any procedures.
Unless you count ECT as a procedure?
Nah.
No, there's no procedures.
There's no procedures.
I take blood.
So yeah, psych was just a big no-no all around.
Yeah. I did psych, hated surgery. You wanted to do surgery, hated psych. Tells you something then, doesn't it?
Yeah.
Number 2, I don't know what to put.
Okay.
Either peds or obs and gynae.
So you don't like the pregnant lady, and you don't like the product of that either.
Anything around the child, nothing. I'm gonna say peds. My dad's a paediatrician.
Oh yeah.
So I've seen firsthand how difficult a specialty is. So generally in the UK, how it works is as you get more and more senior, your responsibilities increase, but your level of like hands-on work decreases. Like you have F1s, F2s, core trainees, registrars, who then handle a lot of the day-to-day work and handle a lot of the procedures and stuff, and you're more of kind of a leadership role, more of in the background, just making sure everything's running smoothly. So as a result, when you hit 40, 50, 60, it's a bit more flexible and things like that. In peds, the complete opposite. The more senior you get, the more you have to do and the more you're needed. And it always felt like that pediatric consultants are on call
all the time.
All the time. They're always having to go in. So
on site.
Yeah, on site. So with psychiatry, with a lot of other specialties, the consultants will be on call, but you're very rarely having to go in, and you occasionally get phone calls and some advice. In peds, you're going in all the time and you're getting a lot of phone calls about advice. And so knowing about the lifestyle, it never really fit in with the type of lifestyle I wanted to have once I was at consultant level. And then learning about pediatrics, I found it relatively interesting, but it was never something that I really enjoyed. No. But I don't know if that was because I had this mindset already that peds isn't something I want to do. So maybe that impacted it in some way. But yeah, I never really considered pediatrics as a career that I wanted to do.
So I think I agree with that. I think peds is pretty low down what I want to do.
Yeah.
I think the thing about being on site, there are other specialties, for example, like some type of surgery or even obs and gynae, where you are needed on site as a consultant quite a lot.
Yeah.
But the thing with those specialties is you're needed on site for important things. So if you're a general surgeon, yeah, if there's a big laparotomy, so a big open operation that needs to happen out of hours, you probably need to come in. But for all the little sort of mid-level and little things, your registrar or your F1s or SHOs or whatever, they can handle it.
Yeah.
Whereas for pediatrics, as a pediatric consultant, you're having to do all them things as well.
Yeah. Sometimes you have to go in overnight to put a cannula in because your registrar couldn't do it. Because it's such a super specialist specialty. There are all these procedures that a lot of registrars maybe haven't had the chance to do or aren't that good at yet because they've not had the experience, especially if you've got a young registrar on call.
Yeah.
So then imagine waking up at 3 a.m. to go put a cannula in a 3-day-old baby because there's no one in the hospital who can do it. Like, obviously it's really important that there is someone available, but I would hate to be put into that position that I'm having to wake up at whatever hour to go and do such a small task.
So the second one for me, seeing as you've taken pediatrics, I think obs and gynae is pretty low.
Yeah.
But I think I'm gonna have to pick GP.
Okay.
And I feel a bit bad saying this because I had really good GP experience when I was in F2. So in F2 we get a 4-month block in GP and you just get a taste of what it's like. So you don't get, 40, 30, 20 patients in the clinic.
Yeah.
You'll get one patient for an hour or, well, not an hour, 45 minutes or half an hour. And you go on some home visits here and there. So the practice I was in was really nice. I really got along with other GPs, with the admin staff, with the receptionists. But the job itself really wasn't for me. And I think it kind of ties into what I said about psychiatry.
Yeah.
A lot of what you see in GP are mental health problems.
Yeah.
And you need a lot of patience to talk to these people, to help them. They keep coming back to you. There's no quick fix. There's only so much you can do as well because you're not a specialist. You feel like you need to refer some patients, but then the waiting list for the hospitals is so long. So they keep coming back to you with the same problem that you essentially can't do anything about at this point. And also, I don't think 10 minutes is long enough to sort out any problem.
No. Because no one comes with one problem either.
Yeah.
It's the human body, like problems are linked. There's very rarely you have one problem that just is that one problem.
Yeah.
There's probably 2 or 3 other things that are contributing to it or as a result of that problem. And it's hard to, if someone says, oh, I've come up with this problem and you help them there, actually, I've just got these other things.
Yeah.
It's very hard to say no.
Exactly.
But you kind of have to because you've only got 10 minutes.
And then you say yes to sort those problems out. Your clinic runs late.
Yeah.
Other patients understandably get annoyed. And people nowadays especially come with a lot of complaints, understandably so I think. They can't get through to a GP, they get through the receptionist, your receptionist has been told to sort of vet the patient, you get an appointment, you can only discuss one problem, you're not happy, you try and get referred to hospital, you're waiting 4 months, you take it on the GP. There's a lot of expectation, which I don't think is unreasonable, but I don't think GPs have the capacity to deliver that at the moment.
I think the public think that the GPs are in control of that.
Yeah.
And they think that the GPs are choosing not to see patients or are choosing to have a poorly run system or are choosing to only have appointments in 4 weeks' time. But in actual fact, a lot of the GPs are just going into work, seeing a full clinic and then going home. They don't have any capacity to see any more patients.
I don't think I could do a job as intense as GPs because you're seeing so many patients. And then go home, tell the news on, and everyone's just like, oh, GPs are lazy and GPs are this and that. I don't think I could do that. Yeah, the whole system basically is not very good at the moment, but that's why I don't want to be GP. I don't want to work in that system.
Fair enough.
That was the specialties we hate, so the worst specialties. If you're part of these specialties, please don't take it to heart. This is just our opinion.
Maybe just comment down below why you did it.
Yeah.
And if what we're talking about is the reality or is it just our prejudice.
Yeah, but psychiatry is crap. Anyway, if you liked the video, hit the like button and comment down below, and of course subscribe to our channel. Apart from all that, we will see you guys same place, same time next week.
See you later.